Good afternoon. Thanks for being here. I'm Chuck Cray. I'm the owner of Hershey Pharmacy, and we're very glad today to host this little event to emphasize the importance of vaccinations with the booster vaccines being approved and people having a lot of questions. Hopefully this gives people a chance to ask the questions and get the answers. I'm very pleased that we're getting the numbers higher and higher, and boy, it's just the emphasis of my heart right now that we get more and more people vaccinated and get everybody protected. So with that, it's my privilege to introduce Secretary of Health Alison Beam.
Thanks. Good afternoon. Thank you, Chuck, for hosting this event and for allowing your team to have the continuing efforts to vaccinate local residents. Chuck, your outreach into the community and work at getting seniors vaccinated earlier this year is so deeply appreciated by our department. Pennsylvanians should be incredibly proud and grateful to the thousands of vaccine providers like Hershey Pharmacy who helped administer more than 12 million doses of the COVID-19 vaccine to date, fully vaccinating more than 6.1 million residents outside of Philadelphia. Throughout this year, we have been incredibly impressed by the dedication and commitment of pharmacies, hospitals, health systems, doctors' offices, and many others who stepped up to administer the COVID-19 vaccine. Hundreds of them helped get Pennsylvania over the hurdles early on when there was not enough vaccine to meet demand. Since then, as expected, the demand has slowed, and vaccines, even more providers have stepped up and helped us reach out to the communities to meet people where they are and get them vaccinated. We now have more than 3,200 providers making vaccine easily accessible to anyone who wants it. In fact, in Pennsylvania, we are averaging nearly 16,000 doses administered every day. We still have a long way to go, but we are making steady progress despite numerous misinformation and disinformation efforts. As Dr. Johnson will tell you in a few minutes, we have plenty of proof that the vaccines work. While we continue to administer first and second doses, vaccine providers are well prepared to start administering booster shots as soon as the CDC gives final approval and issues guidance later this week. To help solidify the preparation for booster shots, today I am signing an order that requires vaccine providers to 1, provide online scheduling for vaccination appointments, 2, provide a telephone number with prompts to a live agent during normal business hours to assist in scheduling appointments, and 3, offer walk-in appointments where possible. Additionally, providers will work with local area agencies on aging and medical assistance managed care organizations to help schedule eligible adults and people who can't leave their homes. These 4 basic steps are not new concepts in Pennsylvania. In fact, they mirror orders issued previously during the initial rollout of the vaccine. Orders such as this and dedicated vaccine providers helped get us to the point where we are today. While we cannot begin administering booster shots until we have formal approval and guidance from the CDC, we can assure you that, first, we have the vaccine available in Pennsylvania, and second, providers are ready to start administering boosters as soon as we have the CDC guidance. Now, it's my honor to turn the microphone over to Dr. Karen Kroc, Penn State Health Milton S. Hershey Medical Center's Vice Chair of Clinical Affairs.
Thank you very much. As a member of this community, I also want to thank Chuck Cray and the Hershey Pharmacy for all that they did to help get the vaccines out so early. I just want to give a little glimpse into what we're seeing at Penn State Health right now. So currently we have 92 COVID inpatients in Penn State Health. And unfortunately, 7 of them are actually under the age of 18, all of whom are unvaccinated. That figure is definitely much higher than what we have seen even just a couple of weeks ago. And what saddens me is that 3 of those children are actually in the intensive care unit. If we think about this time, the surge that we're seeing now, about 30% of all of our patients are in the intensive care unit. That's compared to about 10 to 15% that we saw earlier in the pandemic. I welcome you to look at the Penn State Health dashboard to look for up-to-date information on a daily basis. Of course, those that are currently being treated for COVID at Penn State Health hospitals, a vast majority of them are actually unvaccinated. So while there is absolutely a lot of talk about getting boosters or getting the 3rd dose, it's very important to remember that it's never too late to get your first dose of your COVID vaccine. Currently, the COVID boosters are available to people who are deemed immune compromised, and we strongly suggest that those individuals should receive this extra shot to help boost their immunity against COVID. We are very supportive of any effort to provide either the 3rd dose of the COVID vaccine or boosters to groups deemed eligible by federal health regulators. But I also implore you that we must remember that our young children, those under the age of 12, are not yet vaccinated. And so we do need to continue to wear our masks and employ social distancing and take other measures to protect those of our most vulnerable populations. Now I'd like to introduce Pennsylvania's Physician General, Dr. Johnson.
Thank you. Good afternoon, everyone. Thank you to Chuck, Acting Secretary Beam, and Dr. Kroc. I'm very glad to be here to address you. Over the past several months, I've really focused my efforts on helping those who were hesitant to overcome their vaccine hesitancy. While there are various reasons that a person may be hesitant to get the vaccine, even in view of the overwhelming evidence that these vaccines save lives, we do need to address that. One of the things that really can help overcome hesitancy is being able to speak with a trusted local provider, someone like your doctor or healthcare provider, or Chuck, your pharmacist, who can really answer your questions about vaccine, but also discuss the impact of the vaccine and the virus. We know that the COVID-19 vaccines have been helping us to mitigate the public health effects of this virus. But however, millions of Pennsylvanians who are eligible have not yet taken that step to get themselves vaccinated to protect themselves, those around us, but especially those who are not yet able to become vaccinated, like those children 12 years and under. And that is what's causing our current surge of cases. Sadly, yesterday, 4,939 new cases of COVID-19 were reported. Right now, in our hospitals across the Commonwealth, we have 2,386 people who are hospitalized and being treated for COVID-19. And we had 68 new deaths. These are preventable. We have safe, effective vaccines that can fight COVID-19. And so those of you who have been vaccinated, I'm asking you to speak to someone that you know, tell them about your vaccine experience. And those of you who are not yet vaccinated, I'm encouraging you to get your COVID vaccine to protect yourself, those around you, again, those who cannot yet receive the vaccines, like our children who are under the age of 12. You have the power to finish this. Now I'm going to turn it back over to Secretary Beam to answer your questions. Thank you.
Dr. Johnson. Thank you.
Questions on today's topic?
please.
Yes, Secretary, we've gotten a lot of questions from the elderly population regarding the booster. If they received a Pfizer or Moderna dose, do they have to receive that same dose when they go to get the booster?
So this question is exactly the type of guidance that we're looking forward to receiving from the federal government as soon as Thursday night. Really understanding what the interplay is and truly the qualifying of getting a booster with the brand that you had your underlying primary vaccination with is one of those critical questions. The key for today is that no matter the outcome to that question and how the CDC advises, Pennsylvania is going to be prepared, and we're going to have the right level of vaccine and vaccinators to be able to meet that demand.
Are you worried that with the impending deadline, I guess, shall we say, to get some of the health waivers, reinstated or I'm sorry, continued? I know they're working on it in the legislature, but do you think that kind of underscores the importance of getting those waivers extended?
So we're always looking to the providers to speak to that issue best, but ultimately we know that providers did leverage the permissions under those waivers to be able to hold vaccination clinics. And so yes, of course, the looming deadline and the expiration of those is concerning.
Can you talk about the difference between, I guess, the third dose that's available right now to certain people and the booster? Because I know a lot of our viewers are concerned because they're hearing, hey, people are getting third shots, but they're wondering why they're not eligible.
Completely understood. And actually, Dr. Johnson, if you're okay, she has the clinical perspective that I think is able to help saliently boil this down for folks.
Thank you.
Yeah.
So the third dose are for people who are immunocompromised. And so these are people who did not mount the full immune response like everyone else would have. And so that's why that dose is authorized for them. It's a third dose to get them up to the immunity that most other people will have. The booster dose is for those who have initially mounted the appropriate response, but that immune response may be waning over time. I think we've seen it in the over 65 population that although they mounted a good response in the beginning, that started to wane. And so that's what that additional dose is for. So difference between not mounting enough of a response in the first place and waning response with time.
All right.
Can you comment on the results of the Johnson & Johnson study? I know there's been a lot of talk about the benefits of having a one-dose regimen, and now it might go to 2 doses. Would you encourage everyone who got the Johnson & Johnson to go back and get that second one?
So not quite yet. I think that that's preliminary information that is out, but there's not a recommendation yet for another dose for the Johnson & Johnson. Again, we are waiting for the guidance from FDA and CDC before that is recommended and then authorized.
Secretary, I was curious. What are your thoughts about the fact that, that 70% vaccination total had been a benchmark you guys had used earlier in the year? Still, to my understanding, still not quite there yet. But my understanding is, though, we've been inching toward that. But can you talk a little bit about the fact that we haven't quite gotten there yet, and we're heading into a season when a lot of people are concerned that this might get out of hand again?
Absolutely. And so, as you know, the evolution of the vaccine rollout has required us to shift from what was meeting a lot of pent-up demand in the beginning to really being able to engage one-on-one and convincing minds and convincing hearts on the safety and the efficacy of the vaccine. And Dr. Johnson's efforts have been tireless on that front. Of course, we always know that we cannot take our foot off the gas on continuing to get primary vaccinations. And so right now what we're contemplating is that there will be this approval for some sort of booster regimen in the future, and we're going to have to do both of those missions at once. The best news is that we are prepared this time. The limiting factors that were there previously in supply are not there. And so we see it as our obligation and our duty to be able to say the order is being able to require the appointment making and really take the best lessons learned from the spring and prepare for doing 2 missions at once.
Do you think that mandates, which is increasingly going in that direction, is the right direction to go?
At this time, we're not contemplating vaccination mandates from the state beyond really what the Commonwealth has done by way of an employer.
I mean, do you think employers, that's a good way to get the population is for private entities to mandate it?
So the Biden administration has clearly taken a lot of movement on this issue, and we'd love to be able to see how that actually moves the needle on getting folks vaccinated. But at this time, there's not the contemplation of doing that at the state.
Anything else? Thank you very
Great.
much.
Thank you all. Appreciate it.